Hello and welcome back to the CNS Pharmacology Masterclass. Here we will talk about another opioid medication, and that is the codeine. So first, let's explain where the codeine sits in relation with the other opioids available. So generally speaking, we have the natural, we have the semi-synthetic, and the synthetic opioids. The natural on two groups, the phenanthrines and the benzyl isoquinoline, and the codeine is with the phenanthrines, and they are called phenanthrines because they contain the phenanthrine ring, and they are the morphine, the codeine, and the theoine. Now the benzyl isoquinoline include the papaverine and the noscapine, and those are the natural opioids. The semi-synthetic opioids examples are the heroin, the hydromorphone, the hydrocodone, the oxycodone, and so on. And both of the natural and the semi-synthetic opioids, all of them are agonist. They work as agonist on the opioid receptors, while in the synthetic opioids we have agonist, we have antagonist, and we have mixed agonist-antagonist. The agonist being the mipridine family, the methadone family, and the tramadol. The antagonist being the naloxone and the naltrexone, and the mixed agonist-antagonist being nalorphine, nalbuphine, bentazocine, butorphanol, and buprenorphine. So now let's talk about an overview of the codeine. So the codeine is an opiate. It's a natural opioid from the phenanthrines. As we mentioned earlier, it is derived from the opium plant. This is here the opium plant, and if we cut this part of the opium plant, we get this material, and that is the material from which the codeine is isolated. The codeine is a prodrug of morphine. It's a methyl morphine, and it is the most commonly used opioid. Now let's talk about the pharmacokinetics of codeine. So it is mainly available as oral formula. It has good absorption with oral bioavailability of 90%, which is higher than the morphine. Remember, with the morphine, the oral bioavailability was 25%, while here in the codeine it's 90% due to less first pass effect, due to the methyl group making the codeine more lipid soluble than the morphine. It is metabolized by the liver and excreted through renal and biliary routes. So it can work by two ways. Either it works as methylmorphine and activate the opioid receptor, or work as morphine when it gets metabolized by the liver. So it either works as codeine, which is methylmorphine, or it can work as morphine after it gets metabolized. Conversion to morphine is variable in different people, but the average around 10%. Regarding the mechanism of action, codeine works as an agonist, as we mentioned earlier, on the mu opioid receptors, and when it gets converted to morphine, you know that the morphine works on the all other opioid receptors too. Activation of these opioid receptors lead to several central nervous system effects. Before we get to the effects, you need to know that the codeine has much less effect than the morphine does. So every effect I will talk about will be much less than the morphine, except for the constipation and the cough suppression. It also leads to euphoria, which is a pleasant effect. It leads to sedation, which make the patient drowsy or sleepy. And it might lead to respiratory depression at higher doses due to inhibition of the respiratory center, and it also leads to cough suppression and meiosis due to the vagal effect common with the codeine. It leads to nausea and vomiting due to activation of the chemoreceptor trigger zone in the brainstem, and it also leads to pruritus, which is related to the histamine release associated with codeine use. And activation of these opioid receptors lead to several peripheral effects, and those include effects on the cardiovascular system, including bradycardia, and hypotension if the patient has another pathology in their CVS system. It also has effects on the GIT system, leading to slowing the movement of food in the GIT system and increasing the tone of the stomach and the bowel, and which ultimately lead to constipation. Regarding the respiratory system, it leads to bronchoconstriction. Regarding the urinary system, it leads to bladder contraction with urethral sphincter contraction, and it also leads to urethral contraction and decreasing the renal function. Regarding the endocrine system, it leads to increase the somatotropin and luteinizing hormone secretion. And regarding the immune system, it decreases immunity by their inhibitory effect on the lymphocytes. So again, regarding the analgesic potency of the codeine is 10% of the morphine. So it is much less than the morphine for the same dose. And it is variable in different people depending on the capacity of converting the drug into morphine. It is more potent cough suppressant, and it has little euphoric effect compared to the morphine. Most of the systemic effects of the codeine are due to conversion in the liver into morphine by demethylation, because the codeine is methylmorphine, as I mentioned earlier. For the therapeutic uses of the codeine, it is used as analgesic mostly for mild to moderate pain. It is combined with paracetamol or non-steroid anti-inflammatory drugs or aspirin to give a better analgesic effect. It also used as a central antitussive, as anti-cough medication, and it is not used in children younger than 12 years of age because of the danger of respiratory depression in these patients. And it is used to treat diarrhea, but there is better alternatives like loperamide and diphenoxylate. Regarding codeine adverse effects, it has less adverse effects than the morphine. The main adverse effect is the constipation, but also the respiratory center depression and the physical dependence. Physical dependence occurs when the human body physically adapts to the codeine. And when the codeine is suddenly interrupted, the person might go into withdrawal syndrome. Another adverse effect is the tolerance. The tolerance means that with recurrent use of the codeine, the same dose would produce less effect over time. So if the patient is using the same dose from yesterday, today would cause less effect, and so on. And they have to increase the dose to achieve the same analgesic effect. Another adverse effect is addiction. Addiction is also called psychological dependence to codeine, and it is behavioral changes and some memory changes that occur due to its effect on the brain. Finally, let's end this with a comparison between the morphine and the codeine. So the oral bioavailability is for the morphine is 25%, while the codeine is 90%. The analgesic effects, the morphine is strong, while the codeine is 10% of the morphine. The antitussive effects is that the morphine has weak antitussive effects, while the codeine has strong effects. Regarding the uses, the morphine is used as an analgesic and is used for pulmonary edema, while the codeine is used as an analgesic and antitussive mainly. And with that, we reach the end of this video. Thank you guys for watching. Please like this video so it reaches more people. And if you want to support more, you can by subscribing to the channel or subscribing to the Patreon link provided in the description of this video. Thank you for watching, and peace.